بسم الله الرحمن الرحيم. زي ما قلت لكم قبل كده هكلمكم عن the nature of pain and why it is important to know the nature of pain and type of pain. So there is mainly 3 types of pain. We're going to go through each one of them. In this part, we are going to talk about the peripheral nociceptive pain. Peripheral nociceptive pain. The other types are the neuropathic pain and the central sensitization pain. So the first one is the peripheral nociceptive pain. So what are the characteristics and where did I get this information from? So this information is based on a study done by Smart et al. In 2010. And this was a Delphi study. So Delphi study, basically, they get the experts and they ask them questions, and then they like see what all of them agree upon, and then they write the paper on that. So this is a Delphi study done by Smart et al. In 2010. So the peripheral nociceptive pain is, the characteristic of it is, number one is pain of a recent onset. Okay, last week I was walking, I twisted my foot, and my ankle is painful now. Okay, so this is pain of a recent onset. Last week, 2 weeks ago, 3 weeks ago. Fine. The pain is localized to the area of injury. Okay, the pain is around my ankle. Job done. تمام. The pain is associated with trauma, or I have back pain. If I sit for 2 hours, I get back pain. Again, this is peripheral nociceptive pain because it is related to a movement or postural dysfunction that you have. Something mechanical that causes that problem. If I sit too long, I get that pain. Fine. Usually is intermittent. So if I rest, okay, if I rest, the pain goes. If I start walking too much, I get more pain in my ankle. Yeah, so very clear eggs and eases. Okay, the aggravating factors are quite clear. If I stand too long, I get the pain. If I sit and rest, the pain goes. تمام, clear. So it's clear aggravating factors and easing factors. Pain is normally associated with other inflammatory symptoms, like there is some swelling around my ankle. Okay, so that's clearly peripheral nociceptive pain. Normally gets better with non-steroidal anti-inflammatory drugs or analgesia. Again, nice and straightforward. I get the pain using some analgesia, helps that pain. Great. Usually gets better within, by time. Okay, the pain is improving. تمام. عشان كده مهم تسأل العيان هو الألم يعني من يوم الحادثة أو من يوم الوعي، هل الألم بيزيد ولا بيقل ولا زي ما هو؟ تمام. لو بيقل يبقى أنا عارف إن أنا بتكلم على mechanical pain and peripheral nociceptive pain. Taking the right sort of time to heal and improve. تمام. مجرد ان الهيلينج حصل انه الالم بيقل والامور بتمشي. تمام. كل الكاركترستكس دي بتقول لي انه انا I am treating peripheral nociceptive pain. تمام. بحاول اوصل ل clear diagnosis, easily done. تمام, easily done, and you do your normal management plan. جالي عندي I have, I twisted my ankle and I feel pain around the ankle. The pain is getting better, and it gets better with rest and analgesia. Gets worse with walking. Gets worse as the day goes on. تمام. Is improving. Okay, well, if all this is the case, so my management would be Okay, take your painkillers, stop all the, not stop, decrease the aggravating factors. تمام. Optimal loading, and the word optimum loading I will discuss that in more details. All of that tells you exactly what you need to do, and that's the importance of knowing what type of pain that patient has. ان شاء الله اعمل لك فيديو تاني بيتكلم عن ال peripheral neuropathic pain, the characteristics, and why it's important to know the how to manage that. السلام عليكم.